Hi, I'm Scott Willis, National President of the APA, and standing here on the land of the Palawa people on the northwest coast of Tasmania. The federal election campaign is well underway. Although we don't know the date yet, we understand it will be prior to May this year. The APA got in really early in the election cycle and we gave the government our pre-budget submission last month, and that's called Physiotherapy, A Path to Better Care. It's a massive and comprehensive document that outlines solutions to improve Australia's health system and patient outcomes. This is the best pre-budget submission the APA has done to date, and it also serves as our election statement. I really do urge everyone to read it, share it on social media and send it to other members. You'll see we've included 3 options papers that the Health Minister Greg Hunt asked me to prepare when I met with him late last year. The options on cancer and exercise, falls prevention and first contact physio are all with the Minister for consideration. We've given the government details of new advanced pathways to strengthen care for all Australians. And we've also sent the election statement and the options papers to the Labor Party and the Australian Greens so that they too can read and understand our vision for all Australians to have access to quality physiotherapy when and where required. During the election, we're really likely to hear a lot of conflicting statements and debate about healthcare, especially residential aged care, NDIS, rural regional access and costs. Health reform doesn't come cheap, but it's essential. And that's one of our ongoing campaigns, is that physiotherapy to be recognised as a critical and essential service for all Australians, and for greater investment in public funding for physiotherapy. We've been slowly meeting with primary health networks, but let me tell you, it's slow and frustrating trying to get funded initiatives off the ground. And yet, during the past 2 years of this pandemic, we've seen what reform at pace can look like. Telehealth is a classic example of this. The reality is governments can move quickly and decisively when they want to. So during the election campaign, you'll see and hear a lot more from the APA about addressing the significant structural, governance and funding inefficiencies that remain in our health system. Let me quickly outline our 4 key areas set out in our pre-budget submission. First, we call for improving patient pathways by addressing the structural barriers to reform, such as referral to specialists and equal funding for imaging like any other health practitioner. Second, we want to really reform the primary health care through new public funded physiotherapy treatment pathways. This includes first contact physio. Third, we call on the government to shift priorities to ensure those most in need are not waiting for care, like aged care, dementia care, disability, Aboriginal and Torres Strait Islanders and the veterans. And lastly, we call on them to implement healthcare reform by acting on the many plans already in place. On that last point, we've pretty much reached peak consultation. There are so many reports, recommendations, inquiries on the government's table. They really do have the solutions on their desk. Our submission sets out a way forward for the next government to reshape the health system towards primary care, and a primary care system that properly encompasses physiotherapy. Governments are always saying, give us the answers. Well, we have. We've shown them how to strengthen care and reduce health disparities. We've shown them how to deliver better outcomes for patients by investing in sustained, integrated, team-based care that incorporates high-value physiotherapy. We know that improving patient pathways will be achieved by really removing some of the structural barriers, and this means reforming Medicare and the referral model that has really passed its use-by date. You can't just keep throwing money into the same fractured system and pretend that's reform. That's why we've called on the government and the alternate government to really use this election to announce their support for the structural changes that matter most to Australians. And this means connecting patients to the most clinically appropriate and cost-effective healthcare, such as physios. That is our vision. It means lifting the barriers and allowing physiotherapists to directly refer patients and to fund imaging requests for patients. We're really continuing to push for investment in public funded first contact physio. It really will take time to achieve our goals, but we know it will provide better, faster access to diagnosis, treatment and care of musculoskeletal pain and other conditions. We know that significant gains will also be found by expanding public physio and preventing and treating injury and for the persistent pain, chronic disease and long COVID sufferers. Our elections are an opportunity to have serious policy issues discussed and debated. And everyone can play their part by using the APA's election statement to raise issues in their electorate and with their local candidates. So again, I urge every member to read the submission, what is on the APA website, and start getting the message out to your patients, local members, media and any external stakeholders. So stay safe, take care, and thank you.